Are you looking for the ultimate legal nurse consulting conference where you can discover how to gain more clients, expand your skills and knowledge? Well, I have the conference for you. Patricia Iyer and I are excited to offer our 9th virtual Legal Nurse Conference to you. We have new speakers, new topics, and so much more to offer you in the comforts of your own home or office. This is a conference for every level legal nurse consultant, from the very beginner to the most experienced. Please join us March 14, 15, 16, 2024 for this virtual conference. Today, I have the pleasure of being with Diane Krasner, who is a national icon in wound and skin care consulting. She will be presenting pressure injury case analysis, strategies, and tips from recent cases. Do you feel overwhelmed by the complexity of typical pressure injury cases? Well, Diane Krasner, who has so many wonderful certifications from her PhD, CWCN, FAAN, FAAWC, MAPWCA, WOCNF, as I said before, national icon, is here to share information with you. Welcome, Diane.
Thanks, Barbara, and I'm so happy to be able to participate in this conference. I'm going to begin by sharing a systematic approach that I first developed in 2012 when I began to review cases. And I've been using ever since, and I've kind of internalized it by now, but I'm going to go through that with everybody and then show how I use that approach and tweak it depending on the volume of the records, what the complaint has said in that case. And I'm going to go through several different cases that I've reviewed during the past couple of years from different settings: hospital, SNF, rehab, home care, and finally, I'll take a quick look at a very interesting criminal case and show how this approach works for all of these different cases, because it's based on the standard of care for pressure injury and wound care. But we'll talk about how to deal with voluminous cases. We'll talk about how to carefully assess whether it really is a pressure ulcer, because that's a real important question to know up front. And then after we go through that, I want to just share some little nuggets about something that's very important that's happened, went into effect in October 1st. That's kind of turned some of these pressure injury cases upside down. And it's a new guidance from CMS that they published for Section M of the MDS. But ultimately, it's going to impact all of these pressure injury cases. And it has to do with end-of-life skin and wound changes. And recognizing, CMS has now recognized that skin changes at life's end, skin failure, and Kennedy terminal ulcers are not primarily due to pressure, and therefore should not be documented as pressure injuries, but rather as end-of-life wounds. So this will change going forward, certainly, and even in our analysis of these end-of-life cases, how we address them.
I look forward to hearing so much more from you. This is really very interesting information and really important information as we go forward in time. And we're looking at a variety of types of pressure injury, skin breakdown cases. Well, please join us March 14, 15, and 16, 2024 for our 9th virtual Legal Nurse Success Conference. Please see the link below, lnc.tips/March 2024 virtual. We look forward to seeing you.